Hello, good evening, everyone. Welcome back to my MVF&x. We are back with another topic today. I'm really happy and excited to be back once again, and we have another interesting and important topic to discuss. And as always, we have a very special guest with us. Dr. Cristina Gavilán is with us, and I'm really happy to have you. This is your first event with my MVF&x, so welcome, let's say, to the team, because we definitely have a huge team of doctors, and it's lovely to have you. How are you? And are you ready to educate us a little bit today?
Yes, absolutely. Thank you for the invitation.
Thank you so much indeed. And before we start, let me just introduce Dr. Cristina Gavilán. She's actually the fertility specialist and gynecologist at Instituto Bernabeu. And she is speaking today she is talking to us from Palma de Mallorca. So I'm really happy to have you here. And today's topic is egg retrieval, and we will discuss procedure, risk, recovery, and that means we will start with the presentation on the topic, but afterwards there will be time for your questions. So as always, please remember to put those in the chat so that Dr. Gavilán can simply answer them for you right after her presentation. She will simply answer them. As you know, it's all being recorded and this is all anonymous. So please remember that it's a safe space for you to ask your questions. So don't hesitate. We definitely want to see as many questions as we can. And of course, we will have around 45 minutes today for our event. So don't hesitate. You can simply ask the questions during the presentation or afterwards, as always. And I would like us to start right away. As I mentioned, we don't have as much time, so let's make sure that this is an interesting and thorough presentation and thorough explanation of our topic today. Okay, are you ready?
Absolutely. Thank you very much.
Brilliant. Thank you so much indeed. Let's go.
So good afternoon, everyone. Good evening for you. My name is Cristina Gavilán, and I would like to thank you for the opportunity to talk to you about egg retrieval. We are going to talk about step-by-step procedure, risks, and recovery. I am a gynecologist specialized in assisted reproduction at Instituto Bernabeu. We have several centers in Madrid, in Alicante, in Venice, in Cartagena, and I am the clinic we have in Palma de Mallorca, to which I would like to invite you. So the topic we are going to talk today is egg retrieval. I will go through several points. First, we will talk about what an egg collection is, so we can understand the process. Then I will explain how the egg retrieval takes place and what we are doing. We will also talk about recovery and the risk associated with an egg collection. And finally, we will have some time to answer any questions you may have. So let's start with the first point, understanding what an egg retrieval is. So to understand an egg retrieval, we first need to understand the ovarian cycle. In a normal cycle, the ovaries prepare for ovulation in the first day of the cycle. During the 10 to 14 days before ovulation, a follicle grows in the ovary until it reaches a sufficient size. At the time of ovulation, the egg is released into the fallopian tube, and a structure called the corpus luteum is created, and it remains in the ovary, and it's responsible for maintaining the hormones for the onset of the pregnancy. Normally, there are several follicles waiting to develop in each cycle. One follicle grows, and the rest disappear. Only one gets to the ovulation. This happens cyclically until the menopause. So in this ultrasound that you have here, you can see the follicles that would be ready to grow in that specific cycle. So with an ovarian stimulation, what we are looking for is precisely to get the follicles that are ready in a particular cycle to develop. And for this, we need to administer medication that will be injected every day, more or less at the same time. Sometimes we can also take oral medication depending on the patients and the protocol that we are going to use. During the process, serial ultrasounds are carried out, in which we can see the growth of the follicles until the moment of the puncture of the collection. In these images, you can see how we see in the ultrasound the growth of the follicles in 2D image and in 3D. Here you can also see a video in which you will see how the follicles grow and how we see it in the ultrasound. So these black things here, you probably are aware, are the follicles, and during the ultrasound we check both ovaries, seeing the size of these follicles. These follicles look black because they are filled with liquid, and inside should be an egg. So 36 hours before the ovarian puncture, a final medication is administered, which, depending on the conditions and characteristics of each patient, will be 𝐃𝐻 or 𝐸𝐵 or similar. What this medication does is it makes mature the eggs in each follicle and prepare it so it can be ready to be fertilized. The time between the last injection and the ovarian puncture is important and can also vary between patients, but usually it's around 36 hours before the collection. So let us now turn to the egg retrieval process. So basically, an ovarian puncture consists on accessing the follicles that we have been growing and aspirating the liquid with a very fine needle. Access to the ovaries, as you can see in this image, is made through the vagina using the same ultrasound scanner that we usually use in the consultation room. As the ovaries grow, they are located very close to the bottom of the vagina. And with the ultrasound scan, the control is very precise, and we access very easily to each ovary. So for this procedure, patients should come to the clinic with an empty stomach approximately 6 to 8 hours before the puncture. And they arrive, they are given clothes so they can access the operating theater, and an IV is taken to administer the medication for sedation, and that we are able to monitor the procedure. Once in the operating theater, sedation is administered so the patient does not feel anything during the process. This is not a deep anesthesia, but sedation, so the waking up process is very fast and the recovery is easy. Sometimes patients prefer to have the procedure without any sedation at all. We've done it, we don't recommend it, but it's something that can be done. So with the patient already asleep, we perform the ovarian puncture after cleaning the vagina. For the puncture, we insert this very fine needle into each follicle, which you can see in this image, and aspirate the liquid that it contains. During the stimulation, we have been making the follicles grow, and with the last injection, the trigger shot, we have made the oocyte in each follicle be mature. The liquid that is extracted in the operating theater is sent to the laboratory, where the embryologists check if there is an egg or not, because follicles can be empty also. So it's very important when we access the operating room to be aware that sometimes the follicles may be empty and not find the expected numbers of eggs or oocytes. So here you can see a video of what we see exactly in the ultrasound when we do an egg collection. You can see the needle accessing the ovary. You can see this would be the ultrasound. So the part that we have to access is very, very, very thin. We go inside of each follicle, and once we are inside of each follicle, we take all the liquid out. And we have to go one by one in each follicle, in first one ovary and then the other one. So you see, we can be moving like we are moving the ultrasound, the patient is asleep, and we are going very softly in each follicle, taking all the liquid out. And you can see all the rest of the organs, the bowels, and everything that is around the ovary. So with the ultrasound, as you can see, our access is very precise, and usually it's a process that takes around 10 to 15 minutes, and it's quite easy. It should be an easy process. So as I said before, and this is, I think, very important, especially when you are going through an IVF process, to have a realistic view of the process, it's very important to understand that the number of follicles that we see in the ultrasound scans are not the oocytes that we will obtain. The oocytes are microscopic. We cannot see them on the ultrasound. And the oocytes, or the eggs that we obtain, are not the embryos, the blastocysts, or the babies we are having. This is very important because we need to understand that we need a high number of eggs or oocytes that will give us a better chance to have a healthy newborn at home. So we will talk now about the risk and the recovery from the ovarian puncture. So once the puncture has been completed, the patient returns to the room where she is monitored. Meanwhile, in the laboratory, the embryologists check all the tubes obtained from the puncture and the number of oocytes. In the next few hours, they will perform the accumulation, in vitro fertilization, or freezing of the oocytes if necessary. During the recovery, the patient's vital signs and awakening are monitored, and if necessary, pain control medication is administered, and tolerance is started first with some fluids and then with food. We also check the urination and that the patient is in perfect state to be able to go home. For me, the most important thing, because you know your patients, you see them, is see how they look. It's just we check everything, but in the end is how they are feeling and if everything is going back to normal. So once at home, we recommend rest that day and a light diet, and if necessary, take painkillers such as paracetamol or ibuprofen. Aspirin is not recommended after the egg collection. It's usually possible to return to normal life within a couple of days, and in case of pain, fever, or heavy bleeding, it's always advisable to contact the clinic or, if necessary, go to the emergency room. Although complications during the puncture are not common, it should be borne in mind that several organs are located in the pelvis. We could see them in the ultrasound moving around the ovaries. So when inserting the needle for ovarian puncture, some of these organs may be injured. This is why the puncture is performed under ultrasound guidance to minimize the chances of injury. And there is also a small risk of bleeding during the operation or sometimes after. So the patient's progress is monitored and she's not discharged until she's fully recovered. In the event of bleeding, which is very uncommon but can happen, it's sometimes necessary to perform an intervention to control this bleeding. So another rare risk during the stimulation is the hyperstimulation syndrome. This occurs usually in women with an excessive ovarian response. After the puncture, fluid may leak into various organs, which will need to be monitored. This is usually monitored on an outpatient basis, but sometimes may require hospitalization. That's why it's so important to control the signs you have after the collection, and if you are feeling that something is not going okay, always better to contact the clinic. But we have to say that with the medication that we use nowadays, this is a very, very rare complication. In the past, this was much, much more common. So in any case, the entire medical team involved in the ovarian puncture process is at the patient's disposal to ensure that recovery is as quick as possible. So it is very important to trust the medical team in charge of your treatment, and during the whole process to have direct communication with us. All the fertility treatments have, in addition to all this medical part, a very important, I would say the most important part, that is the emotional part. And this is very important to control. Our top priority throughout the process is always to work together with our patients and to make the process as bearable as possible. And of course, to make happy families in the end. But it's important that you have the know of the doctor and that you feel confident to tell your doctor if you are not feeling okay, if you're anxious, if you feel that something is not going as it should before the collection, of course, the day of the collection or after. So please, now I'm at your disposal to answer any questions you may have. So I'm happy to answer everything that you want to ask. Thank you.
Brilliant. Thank you so much. I believe that we've used it for you already, but of course we are here for your questions. So if you have any, you know what to do. Don't hesitate to that. Everyone will be happy to answer them for you. I don't see the questions here yet, but I'm sure you will have some, so go ahead, type those in. In the meantime, I will definitely would like to start with some most common questions that we usually receive when we are discussing this topic. As you can imagine, this is not the first time we've been talking about it, but I think it's very important for us to discuss this every now and then. You've mentioned this during your presentation. Is egg retrieval painful? Because I think that very often patients are scared just because, you know, this is something new for them most of the time as well.
So the process itself, it's not painful as you are going under sedation. Yeah. But it's not just the pain during the process that you are not going to feel absolutely anything. It's, you know, that we all hear these stories about going through an operation and feeling or hearing things. That's something that nowadays it doesn't happen. But when you go to the operating room, of course, you've had the whole stimulation, your ovaries are big, you have that kind of feeling of before the ovulation pain, the menstruation pain. So that kind of discomfort is normal. During the process, you won't feel anything. During the process, you, with the sedation, actually you will feel pretty good. Probably will be the part of the process that you feel better. And after, you will feel released because the pressure inside is going to be lower, but also you will have that feeling of kind of like a light menstruation pain. So no pain, but if you feel something, it's not uncommon also. But the recovery is quite fast usually.
Okay, that doesn't sound too scary. But many times I've heard that, you know, some people are feeling like bloated after egg retrieval. Is that true? Is it something that you also
Absolutely, and it
confirm?
depends on the size of the ovaries. With the ovarian stimulation, we always say that if we have lots of eggs, probably we will have lots of symptoms. So on one hand, you are feeling worse, you feel more bloated, you take longer to recover, but on the other hand, you are going to have more eggs. And women with very low ovarian reserve, usually they go very well through the stimulation, the collection is fast, they don't feel that much, they don't have that bloating feeling, but of course the number of eggs is lower. So it's this balance between having lots of eggs and having lots of symptoms.
Right. All right. Okay. So another question on the other hand is what should I eat? Is there anything I should follow, a diet, etc., before egg retrieval? What do you usually advise? How should it work? Before the actual egg retrieval? Yes.
Your usual diet, whatever you eat, we don't recommend before any intervention to have a very heavy meal. But with the feeling of the ovaries growing, the body is going to tell you, it's not going to tell you to have a very heavy meal, probably light meal before, and that would be fine. But we don't really advise any kind of specific diet.
Okay, just a normal one, just follow that. It should be okay. All right. I see some questions, and how many, this is also again a common question. How many recovery days would you recommend? So how long does it take to recover?
So this is completely personal. I've had patients that the same day of the collection in our clinic, we have lots of patients from abroad. So that the same day of the collection, they took a plane and went back to their country because they needed to work or something. We have patients that 1 week after are still feeling that discomfort. So I would say the media would be like being back to normal in around 2 to 5 days. We don't recommend to have intercourse or heavy exercise until 5 days. We don't recommend swimming or like baths in the 2 to 3 days after the surgery. But usually in 2 to 3 days, you can go back to normal.
Okay, so again, doesn't sound too scary, so you don't need to worry. There is another question here in Spanish, so I will show it to you. I'm not going to read it.
I can translate it.
Thank you.
I can translate it. So it said if we use flashing when we don't get the egg in the first retrieval. So flashing, in case you're not familiar with it, is when we go inside of the follicle, we take the liquid, we place the liquid back again in the follicle, and we take it. So the idea behind that is that sometimes the egg is attached to the wall of the follicle. So putting the water, the liquid in and out, gets the egg out. So this is a thing that has been done. Sometimes there are lots of studies regarding this topic, and there are studies that show that we get more eggs. Lots of studies that say that we don't get more eggs, and some studies that show that we have more complications. So it's recommended not for ovaries with lots and lots of follicles. It's more recommended for women with low ovarian reserve. If we have 2 or 3 follicles, it makes sense to sometimes do the flashing. We do it like very personalized. It's not something that we do standard for in all the patients. And I think it's a process that done with the patients that need it can be helpful, but I wouldn't say that it's something that. And the other thing is with the flashing, as the time of getting the liquid out and putting it back doubles, all the process gets like longer and longer process usually get to more complications. So if it's done in the correct timing, I think it's something that can be discussed.
All right. Okay. And while we are on that topic, so you kind of mentioned this, but so what can go wrong? Yeah. Is there like what can go wrong during egg retrieval? What is the most kind of common thing?
So thankfully, I'm a doctor and I've been doing lots of different surgeries. So luckily, egg retrieval is a process in which usually nothing goes wrong. But what can go wrong? So it's a process, we have other interventions in which we have a higher risk of not things going wrong, but having more complications. But this is one of these processes that usually everything is well controlled. Usually the patients are young, usually the patients are very controlled. You've seen the ovaries as they are your patients lots of times, so you know where you are doing things. But what can go wrong? The first thing would be bleeding. We go with a needle inside of the body. So it's the same as when we have a blood test that they tell you press here after they've taken the blood out. Well, this is the same, but we cannot press inside. So we always control. If there is a bleeding, we usually see it when it's bleeding. And body usually stops the bleeding as the needle is very thin, but that's the most common complication. The bleeding can be a bleeding that goes outside, which is very easy to control, or a bleeding around the ovary. If there is a bleeding around the ovary, in, I would say 95% of the cases, it's just waiting and seeing what happened. And in that 5% of the cases, you need sometimes to do another procedure to go inside of the belly and stop the bleeding. The risk of bleeding is described in 1 in every 10,000 egg collections. So the risk is low, but of course, in Spain we say if you don't fish, if you don't fish, you don't get wet. So that's something that if you do lots and lots and lots of egg collections, you have that risk of happening.
Your patient has to always be informed, I guess, right? But you need to explain. However, it doesn't happen too often, so there's nothing
and of course,
you should really be worried about.
Exactly, all the patients are given, of course, all the information, and there are certain patients that have a higher risk of bleeding if they have medical conditions, or when you see the ultrasounds, they have more vessels around the ovaries, or there are certain patients that you have to inform that the risk is higher, and of course, all the patients are given. We give them an informed consent that they have all the risk, and they sign the risk that they are going through when they go through the collection.
That makes sense. Of course, you need to be informed at all times. But again, as you said, 1 in many cases. So again, this is something that you shouldn't be really too much worried about, I guess, as well, right? All right. If you have more questions, we still have some time, so go ahead, type those in. In the meantime, I would like to ask you something again, because we also receive kind of questions. So, can you get pregnant naturally after egg retrieval? I believe you've also heard that question from patients.
You mean the moment after the egg retrieval?
Yes.
If the egg retrieval is done properly and we've taken all the eggs out, you shouldn't.
Yeah.
But of course, there can be some follicles that are still in the ovary, sometimes because the ovary is not completely accessible. So talking about the risks, if you have a big vessel around a follicle and you have a very high risk of bleeding, maybe it's better to leave that follicle there and that egg than risk a bleeding for the patient. So we always recommend not to have intercourse until and that would be more for the recovery, but that could be a potential risk. I would say I've never had a patient that got pregnant after egg retrieval, but that's something that could happen. That wouldn't be my main concern, though.
Of course. But yeah, I totally can understand, of course, but that explains it why you actually advise also not to have intercourse or something like that, because of course, I mean, people should be also aware. So thank you so much for that. And one of the other things that sometimes I receive and hear, and so can egg retrieval damage ovaries as well?
During the process, during a process with no complication, I mean, normal process, it shouldn't, and it doesn't. Actually, what we do, if you think about what the ovulation is, in one of the slides at the beginning, it's a follicle growing the ovulation, but it's the ovary has to break so the egg can be released. So with an egg collection, we don't break the ovary, we go with very thin holes in all the follicles, and the ovary has this huge potential of healing. And it's something that it's, even for us, that we see every day. You see these very, very big ovaries after an egg collection. We control them usually 1 week after, and you see that they go, in just 1 week, they go back to normal. They look absolutely perfect. And when we see them in surgery, sometimes that you need a surgery after, you don't find scars or anything. So the ovaries is a tissue that really recovers very easy. The main damage with the ovaries, and this is seen not with egg collection, but usually when we have cysts and we have to remove a cyst,
right.
That's the risk of losing the good eggs waiting in the ovary. That doesn't happen during the egg collection because we just take the liquid, we don't take any tissue from the ovary. So I would say that absolutely no, it doesn't damage the ovary.
Okay, I think that's reassuring for everyone listening, I'm sure. I don't see more questions, so if you don't have any more questions, we will be slowly finishing, but if there is anything that you would like to ask, we still have some time. If not, again, there is also a possibility for you to get in touch with Dr. Gavilán and her team at Instituto Bernabeu directly, and I'm sure they will be happy to help you out with more questions. I do see that you are listening, and if you don't have more questions, I think that we will be finishing for today. But I would already like to thank everyone for your presence today. Dr. Gavilán, thank you so much for your time. And before we actually finish, any final words, anything that you always advise patients before the actual retrieval? Is there any tips you could share with us?
For me, the most important thing, but not just egg retrieval, but the whole process and embryo transfer and everything, is tell your doctor everything that you are feeling, because you know your body. We doctors know the patients for 1 month, 2 months, 3 months, but patients know their body. So trust your body. Right. Whatever you feel, even if feels normal but you don't feel it normal, tell your doctor, and take care of the emotional part of the egg retrieval. What you are feeling, your fears, your thinking that if you have 10 follicles and the day of the collection you have less follicles. That emotional part, I think it takes a huge impact in the recovery process and how you leave the procedure.
That sounds about right. Thank you so much. And as I've mentioned, we will be finishing for today, but thank you so much, everyone, for your time. Dr. Gavilán, again, I know it's been a busy day for you, so I'm sure you're ready to rest and go home. So thanks a lot for your time, and it was lovely to have you. And I'm really looking forward to perhaps some more events. So thanks a lot, everyone. Have a lovely evening. And of course, this has been recorded and will be available on our website, My IVF Answers. So you will be able to look it up as well. It will be available tomorrow on our YouTube channel as well. Thank you. And as you can see, Maria also would like to thank you for today. So thanks a lot. It's been great to have you. And well, have a lovely evening. Take care.
Bye.
Bye.
Thank you very much.